Okay, this is health assessment number 2. We're going to be looking at the eyes, the nose, the ears, the mouth, the lungs, and cardiovascular system. So we're going to start off by scanning the room. Plug my laptop again. Okay, one of the first things when you are testing someone's vision, you do the Snelling chart, which most people are familiar with. You stand 20 feet back from the chart and you read from the biggest letter all the way down to the smallest letter that you can from left to right. 20/20 is considered normal vision. You're going to want your patient to do it if they wear glasses or contact lenses with those in, and then you're going to want them to do it without. 20/200 is considered legally blind. On the chart, it tells you from the top to the bottom if it's 20/40, 20/30, or whatever. So the smallest number that the patient can read with getting them right is what their vision is considered. Another eye test that you will perform is the Rosenbaum test, and that is what is tested with near vision. So the patient is going to hold a little Snelling card with the numbers and the letters on it, approximately 14 inches away from their face. Same thing, reading from biggest to smallest, from left to right, and that will tell you if they have any issues with their nearsighted vision. Normal is 14/14. So we're going to go ahead and do a peripheral eye exam. So I'm going to have you hold this over your eye, either eye. We're going to do both eyes. So and then you hold it on the same eye as the patient is holding it on. So let me know when you can see.
Now.
Okay. And switch eyes. And let me know when you can see.
Now.
Okay. And as long as it matches up with you, most likely they don't have any issues with their peripheral vision. We're going to move into the movement of the eye, which tests cranial nerve. We just tested cranial nerve number 2, which is the optic nerve. Now we're going to test cranial nerve number 3 with the exterior ocular motion of the eye. And we're also testing cranial nerve number 4, which is the trochlear, and cranial number 5, I believe, which is the trigeminal nerve. So you're going to do the cardinal gazes. So what you're going to do, so just follow my finger. And you're just going to want to make sure that the movement is smooth and they can follow with both eyes and there's no lazy eye or drifting of the eyes. Next, we're going to move in and we're going to test the corneal light reflex, also known as the twinkle test. So what you're going to do is you're going to take your optoscope and you're going to shine it in their eyes. And you're just checking both eyes that there's a twinkle. And both twinkles are present. So we're going to do a cover and uncover test now. So you just go ahead and look straight forward for me. And what we're testing for with this is to make sure that neither eye is drifting when you uncover it and both of them have the same reflex. So let's go into inspecting the eyes. We're going to inspect the eyebrows for the symmetry, the color of them, and making sure that there's no discoloration or differences in symmetry. We're going to look at the patient's eyelashes, very pretty eyelashes. We're going to go ahead and we're going to look at the anterior chamber, the lacrimal apparatus, the cornea, the iris, the conjunctivitis, the globe, and we're going to check the eyes for pearls, pupils equal, round, and reactive to light, And then we're going to go ahead and palpate the lacrimal duct at the end of that. So we're just looking for any discoloration, anything like lesions or anything that's out of the normal when you're looking at somebody's eyes, color, symmetry, and things like that. Nothing was noted, and the lacrimal ducts palpated just fine. We're going to move into the cranial nerve number 2, the optic nerve. So we're going to inspect the lens on the patient and check for red reflex. And we're going to look at the disc, the size, the shape, and the color on the disc. Okay, he's got a good red reflex, and he's got a good size disc, and the shape is round and normal. So we are also looking at the retinal vessels and the AV ratio with the nerves in the back of the eye, the macula, and the color of all of that when we're looking, making sure there's no hemorrhages or anything like that. We're going to go ahead and move into looking at the ears now, which is cranial nerve number 3, the acoustic cranial nerve. So we're going to look at the exterior of the ear, also known as the meatus. We're going to look at the canal. We're going to look at the mastoid, the tympanic membrane, which when we look inside the ear we'll see. When we are looking at that tympanic membrane, we're looking at the cone of light. Make sure there's no discoloration, there's no holes or anything like that visible to us. We're going to look at the malleus, and we're going to look at the umbo. So I'm going to go ahead and look in his ears now. This might tickle a little. So he's got a good cone of light. And also a good cone of light with that ear. So now that we inspected all of that, the size, the shape, the symmetry, his ears appear to be normal, we're going to go ahead and move into his nose. We're assessing the symmetry of the nose. We're going to look at the septum, make sure that it's not deviated. We're also going to make sure that he has patency in both noses, and we're going to look at the turbinates. We're also going to assess his mucous membranes and make sure that they're moist and pink. Go ahead and look up for me. Okay, and all of that is normal. One thing that I did forget, now that I think about it, when you're testing somebody's ears, you're going to do a whisper test. You're going to stand by their ear, and you're going to whisper a word and see if they can hear it. Okay. Two things else that you would want to test when you are testing the ears would be in cranial nerve number 3. You would need a tuning fork to do. It's called the Weber test and the Rhine test. The Weber test is in the middle of the forehead, and the Rhine is on the mastoid process. I unfortunately don't have a tuning fork to do those tests. So we'll move back to the nose now. When you're testing the nose, you're testing cranial nerve number 1, which is your olfactory, your sense of smell. Now that we covered everything with the nose, we're going to move into the mouth. So we're going to assess the patient's lips, the color, the symmetry of the lips. We're also going to be looking at their teeth, their mucosa, and their gums. Can you go ahead and open up for me? Okay, nice pink gums. Appears to have all of his teeth. His lips look good. No sores or lesions. We're going to go ahead and we're going to look at the tongue and make sure that the tongue and the palate and the uvula, and I'm going to have you open up for me. And go ahead and say ah. Okay, we're just looking at the symmetry of the uvula in the back of the throat there. I'm going to go ahead and look at the palate. And lift your tongue all the way up, and all the way down. Okay. And so I've been watching him, observing him swallow and talk to me. That is, you're assessing cranial nerve number 10, which is the vagus nerve. And then when you say ah, you're testing cranial nerve number 9, which is the glossopharyngeal cranial nerve. When you have a patient move their tongue from left to right for you and up and down, you test cranial nerve number 12, which is the hypoglosseal cranial nerve. So now that we covered our eyes, our ears, our nose, and our mouth, and our vision, we're going to move into the lungs and the cardiovascular system. So with the lungs, you first want to inspect the anterior and the posterior of their back. You're looking at the symmetry, the color. You're looking for if there's any abnormal movement in their chest, the shape, if they have a barrel chest, if they have just a normal symmetry between the two lobes, which he has normal symmetry on the front and on the back of the chest. We're going to watch their respiratory pattern to see if they're breathing 20 per minute, they're breathing 30 per minute, how fast they're breathing, if they're breathing really quick and then stopping breathing, or what their pattern is. So we're going to watch his expansion of his chest. And some patients, their chest doesn't expand. They might, like pediatrics, their bellies expand more than their chest. And that's why pediatrics are called belly breathers. So we're going to go ahead and we're going to palpate the chest. And we're looking for any bulges, any masses, any lesions, or any tenderness. My hands are really cold.
Freezing.
Okay, and I'm going to feel on the posterior side as well. Okay. We're going to go ahead and we're going to percuss the posterior lungs and the anterior lungs. We're looking for dullness and then renaissance. I'm going to start on the posterior side. Okay, and dullness is normally around T7, T8, and you're going to hear renaissance around T10. We'll go ahead in the front. Okay, and then once we've done that, we're going to go ahead and we're going to auscultate the lungs, anterior and posterior. From apex to apex, base to base. Go ahead and take a deep breath in. And exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Okay, just going to listen to your back. Deep breath in. Exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Good. So we're just listening for any abnormal lung sounds such as rails, crackles, anything along those lines. His lungs sound good. He had full expansion, and nothing was noted out of the normal with his lung sounds. So we're going to move into cardiovascular. We're going to inspect the chest first for any heaves, lifts, or thrusts. I can see a pulsation slightly on him, which is normal, but I don't see any masses, any bulges, or any heaves or thrusts on him. We're going to palpate the anterior chest for PMI in murmurs.
Cool dance.
I'm sorry. This is at the fifth midclavicular intercostal space. No murmurs are noted there. We're going to go ahead and auscultate first the aortic area. Okay, and with that, we hear S2 over S1. Next, we're going to do the pulmonary area. Okay. And also, I hear S2 instead of S1 there. Next, we're going to do a point of herbs, and then we're going to move into the tricuspid area. Okay. And with that, we are hearing S1. So after listening to all of that, we're going to go ahead and we're going to palpate the temporal, the brachial, and the radial pulses. So, crowded. Go ahead and check his brachial pulses. Good. And his radial pulses. They're equal and strong in all points. A good way to assess is you can also feel the carotid pulse at the same time as you're feeling the apical pulse and making sure that they're equal with each other. And they are equal. So some other pulses that you want to listen to is the popliteal pulse, the posterior tibial, and the dorsalis pedis. So where you're going to find those pulses is the popliteal you find behind the knee. And that posterior tibial you find on the backside of the leg, posterior. That's good. And then the dorsalis pedis you're going to find on top of the foot. You want to assess on both sides to make sure that they're equally strong. If the pulses are weaker or dull in those areas, you could have either a vascular or aortic insufficiency in those areas. So that's going to conclude my assessment number 2 for health assessment class. Thank you for helping me.
No problem.